piece. It stopped, my hands come right off, all right?
Yeah.
Very complicated.
Not banana?
Not banana.
Got it.
No. We tried that once, but then the patient forgot the word. So, think into the table. There we go. There was another one there. Okay. I think the second thing is for you to not know that I'm about to do it.
I figured it was coming to be honest.
Okay. He knows the tricks.
I've seen these chiropractic videos before.
Can't fool Kiyan. Yeah.
Never let a good crisis go to waste.
Never let it. That's somebody said that.
I think it. Okay.
It's a financial expression.
Yeah,
That's
I can't
from
remember
something.
I can't remember who said it
but
either.
If you know where that's from, please leave it in the comments because we've heard that. Never let a good crisis go to waste. Kiyan, good to re-meet you, man.
Yeah,
It's
man.
been
Been a while.
It's been how long has it been? Like six
Since the summer. It was
since
that
the summer. So
really
maybe-
hot chamber event.
Yeah, so maybe like 6 months ago. So Kiyan is a really cool guy because he owns a gym, okay? And I like people who own gyms because they get the lifestyle, they understand the physical activity. It's important, very beneficial, and you're able to spread that to other people. So Kiyan is in today dealing with, you've had neck discomforts going on for how long now?
Oh man, over 10 years.
Over 10 years.
In a long time.
And it took him almost 10 months to come in and see me, but funny coincidence. Okay, so 10 years. Can you kind of tell us a little bit, whatever you're comfortable sharing, about like when it started, why it started, how you've been dealing with it so far?
Yeah, well, it all happened back in like 2013.
Okay, we're shooting this in 2024.
Yeah, I used to smoke weed. Don't really smoke weed anymore. I stopped for a bit, and then I started smoking again, and then I just had like a really bad reaction to it, and my neck started like spasming.
Okay, you had a bad spot.
Pretty bad.
Okay, yeah.
And I felt like crap for like 2 months.
Really?
And I didn't know what was going on. And then every time I would go to a doctor, they, would kind of write it off because I'm just like some 23-year-old kid.
Yeah, bad reaction. You're going to get pushed aside pretty quick and then you get on to the next person. Right?
Yeah, so like the 23-year-old kid just had a bad reaction to smoking weed. Oh my God, call the FBI, right? That's pretty bad, right?
Yeah.
So then it just, it did get better after like a couple months. But it was still never like fully
still
the same.
always felt
it
kinda,
always, yeah, it was always pretty tight.
Okay.
And I had like a couple other things that just like kind of like made it worse, and like I had like a back injury that kind of just like resonated up here.
Ooh, okay.
But then I tried to like get it fixed back in like 2016 or 17, somewhere around there. And I went to go get like acupuncture and like cupping done.
Yeah.
And it just made it way worse. But because like as soon as I was done there, I remember like going to the gym and then as soon as I was done at the gym, I went and took a nap.
How was that workout? Was that workout like okay, or was it?
It was fine. It was a little bit of cardio, nothing crazy,
nothing intense. Okay.
And then when I went home and then took a nap, and then when I woke up from the nap, it just like everything like seized, and I was like, holy crap, and that felt awful.
That was bad.
That was really, really bad. That lasted for like a year. It was really
wow.
Really bad. It's still kind of bad.
Time. Okay.
So if I get stressed out, this will tighten up like crazy, and then I'll feel it in like my occipitals right here.
Yeah. I always love when people use the right anatomical term. So if he's feeling up in the suboccipital muscle group, and it's been going on for like years and years and years, how have you been managing it since then? Because obviously there's a big gap between 2016, I guess, and 2024.
So yoga and working out and trying not to get stressed, but as an entrepreneur,
okay, sure, I'm not getting stressed. Funny joke.
Yeah, it doesn't really work out that way.
Not at all. No. If any entrepreneurs are watching this channel, comment down below about how you fight stress because we're desperate to figure that out too. Yeah. Okay, so. Yeah, all right, so you've just been kind of doing it through a lot of physical activity, right, which is great. Yeah. I absolutely love people who get active when it comes to their complaints because that is self-empowerment. That's finding ways to almost self-medicate minus the pharmacological, right? So good on you for doing that. I know that it can be difficult to move and exercise through pains, but Kiyan, too much of a badass to let that get in as well, right? So now, if you haven't seen a massage therapist, you did see a chiropractor. Was this for the neck or?
I did, yeah. So actually, I think I saw a massage therapist somewhere around there. I can't exactly remember when.
We're talking a long span of time.
Yeah, because it's been a while. Because that happened like 2017, so it's been like 7-ish years somewhere around there. And I just found out that like working out and yoga definitely helped to mitigate the pain.
So with that, you're still doing that on your day-to-day, right?
Yeah.
But there's still, is it particularly bad today, or just you're kind of just in?
No.
Okay, good.
Yeah, so when I get stressed, right, that's when it really starts to like flare up.
Okay.
And I'm always in like a perpetual state of stress. So,
you wouldn't believe it. Look at you. He
owners.
seems so calm. He's got a big smile on his face.
Yeah, but I keep it all in the neck.
Okay.
it's all hidden right here.
Okay. So I mean, when you saw that chiropractor, he didn't adjust or crack your neck, did he? Because I think we talked about that briefly off camera, or did he?
I can't remember. It was a long time ago.
Long time ago. Okay.
It was actually not too far from you.
Close by.
Yeah, it was a Dynamic Health and Performance.
Oh, he's right over there. No, I know those guys.
Dr. Weeks.
They treat very much like physiotherapists. Okay, so they were probably the ones who were promoting like the activity, which is great. Okay, again, because that's the self-empowerment. That's the thing that you can take forward and like run with the rest of your life. So you could very well manage this. That being said, anytime somebody has a manual or a mechanical, issue, meaning like muscles, joints, whatever, it can be beneficial to have that worked on manually. Just kind of makes sense, right? It can be an extra little boost for when you're feeling particularly stiff or particularly stressed. These are things that can help whack it under control and then be further compounded on by the exercises, right? So there's a place for manual therapy in there too. That sounds like it hasn't really been being used. Maybe that's because you're, again, a business owner, and when you're a business owner, money's sometimes tight, especially when you're building things out, and that's very much the case for everybody who's been there before, right? Yeah. She looked very confused. That's what sorry. Somebody walked by the window there. But what we're going to do today is we'll do a physical exam. Okay, we'll do a range of motion. We'll screen and see if I think that we'll be able to help you out with what we do here, okay? Are there any questions about that before we get into it? Or
Nope.
Nope? Awesome. Well, I guess they'll come up as they go. You should bring both arms up for me there, Kiyan. Oh my god, look at your forearms, man. The vascular area. Okay, keep it there. Don't let me push you down. Fight. Good. And fight. Good. Arms forward. Curl the wrists backward, please, okay? Don't let me move them. Fight. Good. Fight. Good. Turn over. Curl the wrists inward. Good. Fingers curled. Good. Turn over. Fingers straight. Please gently squeeze mine. Good. Thank you. Yeah, perfect. All right. Now you can relax there. I'm going to do your reflexes here. So just relax that arm for me. That's good. That's good. And drop the arm into my hand. Drop. Good. That was a little bit of a shocker there, right? So
a little bit.
Body tense up. Turn you over there. Think that, yep, that can be seen. Good. I'm going to bring this arm up. I'm going to come from behind. Just drop the arm into my hand. Give me full weight. Good. There we go. Perfect. So that's a normal upper limb neuro exam. Kiyan was telling us about his long-standing neck issues. Which side was bothering you more? I think it started with the right side. Yeah. Okay, good. So I'm going to get you to start just by turning your head as far as you can to the right for me. As far as you can. So we can get to about... I'd call that about 70 degrees. Is that uncomfortable for you when you do that?
Because
I'm noticing
over here.
I'm noticing some shaking as you're doing that. Are you just kind of like a shaky guy? Or
No.
is it like that? Okay, good. All right, so 70 to this side. I'm going to get you to turn and face the other way now. Okay, so here we're only actually able to get to a 45. Okay, so that's a pretty significant difference in rotational ability. The right side probably doesn't want to let go as much as the left side is willing to, hence why it's not letting him get that full rotation, because it's simply not relaxing in that sense. I'll get you to bring your chin down to your chest for me, as far as you can. Does that provoke discomfort back here for you?
Nope.
No? What if I do something kind of mean and push it further? How about now?
Well, now a little bit, yeah.
Now a little bit. Is it that right side or left side?
Kind of right here.
Right, it kind of in the center. So he's pointing kind of like everything, like dead center and off to the sides. I get you to look up towards the ceiling for me. How's that?
Oh, it's fine.
It's fine. Now what if I do something kind of mean? Pull. Still okay?
Yeah, obviously you can feel like a little bit.
Yeah, in like the front stretch, but that's normal with that.
Yeah.
I'm going to get you to tilt the right ear to the right shoulder. So we're able to get to 45. Good. Now left ear, left shoulder. Less, maybe like 30. Okay, so from that we can definitely tell that the right side is involved. He's not making it up. Not that I thought you would be making it up. But there's quite a bit of tension that doesn't want to come. And even just feeling the tone of the muscles on both sides. Like, he's either got a lot of tension here or he's significantly more jacked on the right side.
I only work out this one
He
try.
only works out the right side. Doubtful of that looking at him. So definitely something to be done there. Next up, I think I'm actually going to get you to go face down, okay? So Kiyan was commenting that he's got predominantly neck pain, right, on that right side. And as we felt through, that upper trap was a lot more tense on the right side as compared to the left. So anytime we deal with a neck complaint or complaint anywhere on the body, it's always good, you got to do your due diligence in examining the areas that are both above it and the areas that are below it, right? So if it was a lower back complaint, we'd be looking at the upper back and the hips. It is a neck complaint, so we're going to be looking at the upper back, okay, as well as the occiput, or the base of the skull there. So we're going to start off by looking at the upper back here. Kiyan, my hands are going on your back, okay? If you want them to come off for whatever reason, the word is stop. Okay, so stop, my hands come right off, all right?
Yeah.
Very complicated.
Not banana?
Not banana.
Got it.
No. We tried that once, but then the patient forgot the word. So anyways, we're going to go ahead and move on up. So the first thing that I'm noticing feeling through Kiyan, and this isn't me kissing your ass, I promise, is that he's a very muscled guy, okay? And I would expect that in somebody who owns a gym. He is his own walking marketing material. But with muscle comes tension as well, okay? But it's good that he is keeping as active as he can. It's good that he's mixing in yoga, a mobility form on top of just the strength training. So you did say it was yoga,
yeah,
right?
Yoga.
Perfect. So good job on that. Keep it up. It actually feels pretty good as we get into like the middle back proper. So let's go ahead and look at only the upper here. So I'm going to get you, Kiyan, to take a big breath in for me and all the way out. And I'm going to get you to do that. I actually wasn't set up. That was too early. So I'm going to get you to take a big breath in for me one more time. And all the way out, all the way out. Sink into the table. There we go. You okay?
Yep.
Okay, so I don't know if the mic picks that up, but there was one little pop right there. Did you feel that?
Yep.
All right, so that is an adjustment. Has anybody done that to you before?
Nope.
No, because I know you were a little bit nervous, but it's just that. It's that simple, okay? Except just in different regions, obviously. Take a breath in. All the way out. There was another one there. Okay. Nope. I don't think, no, there was another very small one there. So not super loud on him, but there were a couple of key points, namely being right here, as well as where the levator scap inserts into the scapula. Very common area, that T2, T3 kind of region. If you're familiar with the channel and the language, you'll know exactly where I'm talking about. We'll put a picture of the left scap up around that region there so that you guys can see exactly where I'm talking to. All right, next up, Kiyan, we're going to get you on your back face up, okay? So we are coming in to work on that neck region. Now I know that we have a lot of tension on the upper traps, and again, the traps are kind of this meaty muscle that you can see on camera here. They span from basically the middle of the back, which we already checked in the previous take here, but then they come all the way up, inserting into as high as the occiput at the base here. So we're going to go ahead and work our way through. Now you were saying that you do get a lot of tension in that occiput region too, right, Kiyan?
Yeah.
Perfect. Yeah. So again, that's why we always want to check above and below. But let's go ahead and work our way through, see if there's any particular areas of tension, or if we're kind of just generic and widespread at this point, which is what I would expect with this timeline. Although that doesn't feel too great to me either.
No, that's pretty bad.
Mm-hmm. So you've never had your neck adjusted before, have you?
I don't think so.
That sounds like content right there. That's good. Mm-hmm.
This is the hook.
This is the hook, yes. I can already see it on the introductory 30-second trailer preview. Alright, so in order to get a neck to go, I need basically two things from you. Okay, the first is for you to turn your head as far as you can to the left and relax it in my hand, okay? That's the first thing. The second thing is for you to not know that I'm about to do it.
Got it.
So, yeah, you did great on both those things.
Perfect.
By the way, yeah. How are you? How did you find that?
I figured it was coming, to be honest.
Okay, he knows the tricks.
I've seen these chiropractic videos before.
Can't fool Kiyan. Yeah. But how did you, like, was that obviously maybe a little nerve-wracking, but, like, did it hurt? Did it feel okay?
Well, it was okay. Yeah, it didn't hurt. It didn't hurt.
Didn't hurt. Okay.
It felt a little weird, but
of course, it's gonna. If you've never had this done before, weird is a great way to phrase it. I just want to re-emphasize to anybody who's watching this. This isn't supposed to hurt. Okay, unless there's an incredible amount of tension, you might get a little bit of a sting, but it's not as violently painful as one would suggest.
And even this side's pretty bad,
This
huh?
side's pretty bad too. Yeah. Impressive. Well done.
Thank you.
Yeah. This feels like it would have been due to some form of stress that we have possibly talked about off camera.
Yeah.
Mm-hmm. Okay, so once again, we're going to turn you. You're just going to relax in that position there. Good job. You release real easy. I barely have to put any effort into that whatsoever. Good job. It means you've taken good care of yourself despite this tension and stress situation.
That's what I try to do.
You succeed. You don't try, you succeed. You do look like you're ready for a nap, though.
I am ready for a nap. Even with the adjustments, I could fall asleep.
That's okay. You are allowed to fall asleep. You actually are. I know I made a joke earlier, but you are absolutely allowed to fall asleep.
In the massage section of the video.
Yeah,
right?
that's when you can pass out. It's going to be tricky because you're going to be sitting up, but I'm sure
I'll make it work.
You as an entrepreneur, you can find a way to make it work, right? Okay, good job. So one of the first things that we noticed on Kiyan when we were checking his neck range of motion as well as feeling the tone was the bulkiness of the right trap as compared to the left. A lot of tension in that region. So what we're going to do here is we're going to go ahead and use our favorite tools that we've used before, right? His upper back actually didn't feel that bad, and I was feeling through it. So for that reason, we're really going to focus in on this area, and it's actually a lot easier to get that on a patient with them sitting up rather than laying face down, which I know that you guys have all seen before. So to that end, when I do this, I usually like to ask the patients more questions about themselves, give them a chance to share to the camera about the kind of stuff that they do and they're into. So obviously you own a gym. That's super cool. Mind sharing about that? What kind of got you interested in the whole fitness world?
Yeah, well, fun fact, I was actually like a server before I opened up the gym.
All right.
And then it gets pretty crazy, right? So had like a bad breakup in 2019, and then immediately, within like the next day, I actually got assaulted, robbed at gunpoint, pistol whipped. Yeah.
Okay,
yeah.
that's
yeah.
I don't even know how to comment.
Yeah,
on that.
no,
Holy shit.
yeah.
Okay.
So and then so this is going somewhere, right?
Yeah.
And
what the fuck?
And I just my nose was broken, like it was pretty bad.
Okay.
So I got.
You look great, by the way.
Yeah, thank you. The nose.
No, I like it. It's part of the charm.
Yeah.
Okay.
But then, but yeah. So I at that point I was obviously kind of not okay.
No, I wouldn't be either.
And I had just kind of let myself go pretty badly. Mm-hmm. And I remember I kind of just stayed inside for 3 months because I was also in between jobs because I just quit my serving job because the whole point was to
I wouldn't
do
go
something
inside
else.
either after a while.
I couldn't even go for an interview. My face was all messed up. So yeah, it was pretty rough. So and then I remember seeing my friends because it happened in September 25th of 2019. I remember the exact day.
Yeah.
And then
year to date.
Yeah, and then in early December, my buddies were just like, dude, what the hell happened to you? You're like 30 pounds heavier. Your face is all messed up. And then I'm like, yeah, it looked even worse before, but and they were right. I did look pretty bad. So in January.
Do you look bad now?
No.
Okay, confidence has grown up.
Yeah.
Confidence has grown. Good. Okay.
Yeah, but then. Yeah, so in January of 2020, I'm just like, I'm going to go run a marathon. I'm going to go start working out again. Because, I was in okay shape before all that stuff. And then, I was training a lot. And I decided to temporarily get a job at a restaurant again. And then get my insurance certificate.
Temporary.
Yeah, my insurance certifications because I have a whole bunch of family members in insurance and I could have gotten a job there. But then... what happened in March of 2020. I'm not even sure if you can say it on YouTube, so I'm not going to say it.
March of 2020. You can say
let's
it.
Let's call it Schmovid.
There was a bit of a thing where people weren't allowed to go outside for a bit.
Yeah, let's go with that. So I'm just like, well, I'm kind of back to square one. I'm not working. I got my certification, but I was just like, I can't get a job again because no one's, there's a lot of uncertainty, right? So the one thing that did change though is that I was in shape.
Hey!
So,
it's okay, we got gains.
Yeah.
It's okay.
So I was like, hey, I was in shape, and I'm liking it. So I remember running outside, because at the end of March, like, everything was just all over the place. I was training for the Around the Bay Marathon, and it got canceled.
Of course. Yeah.
And I remember training, it was freezing outside.
Yikes.
The world was just in chaos. I was still a little heartbroken after the breakup, and my face kind of still hurt, and my face was still swollen, but I felt okay.
Okay.
Everything was okay. I was
Hey.
like, okay is good. Right? And I'm like, hey, maybe there's something to this whole fitness thing. I wish everyone could kind of feel like this, because like when everything else is going terrible, if you have your health, then that's like
That's going
still
okay.
that's
Yeah.
still really good.
Mhm.
Right? That's you know, that's a big step in the right direction.
So I'm just gonna quick little caveat. It sounds like you were in a really dark place.
Oh, yeah. Oh,
and
yeah.
you managed to find your way through fitness. Okay, that's the very similar thing happened to me. We're not gonna get into
Yeah.
my story because this is about you, but like it's worth noting that there are actually a lot of studies out there that show that consistent resistance training and exercise are as effective or more effective than antidepressants in people dealing with these kinds of emotional issues. Okay, so when people say exercise is medicine, that's not an expression. That's not a joke. Like that's legitimately measurable. Okay, so like good on you because you self-medicated with exercise, which is the best kind of medication because it's not medication at all. It's not pharmacological, right?
Oh, yeah.
So well done. Give yourself credit where credit's due. I hope you do give yourself credit there.
No, thank you.
Yeah, no problem.
And because I completely agree, right? It's so important, and then it got to a point where I'm like, I was just like, I hope everyone could kind of feel like this and understand the importance of it, because I didn't realize how important it was. Because I was one of those kinds of guys, like I would go to the gym, but
I tried whatever. It's just a thing you do.
Yeah,
right?
I tried to out-train a bad diet, but then once I started to get proper nutrition habits in place, then I started to really, really feel good. I'm like, wow, this is awesome, right? So then I just really thought about it. It's like, okay, maybe I should open up a gym, and then I realized, you know, in 2020, maybe I should wait a little bit because we don't know what's going on now.
Yeah, 2020 is not the time to buy a gym unless the person who I'm talking about knows who knows I'm talking about them. But like, so when did you open up?
So I waited just because there's probably going to be another lockdown, and there was. So it was August 2021. Open it up. Yeah.
That's not that bad. That's that's 3 years now. Oh yeah, we talked about that. Like 3 years, very similar.
Yeah.
Right? Okay, I'm going to get you to look up and to the right for me. And to the right, good. Now slowly down and to the left, okay? Go ahead.
So down to like...
Yes, slowly down to left. You're going to look like towards the skeleton's feet there. Good. Now up to right. You can keep talking while we do this, but I just need you to keep moving that motion. Down to right, unless it's hard to think.
It's hard to think.
That's fair, yeah. Directions are tough, man. I believe you. Up and to the right. And down and to the left. Good. Up to right. Down and to the left. And up to right. Down and to the left. Good. Face forward. I want you to tilt your right ear to your right shoulder, please. Now tilt left to left. Good. Right to right. Left to left. Right to right. Left to left. And right to right. Left to left. 2 more times. Right to right. Left to left. And right to right. Left to left. Good job. But yeah, no, seriously, you should be incredibly proud because that depressing place that you were talking about, not everybody always comes back from those places.
Oh yeah, it was pretty bad.
You came back and then some. No, all right. So the new and improved Kiyan.
Yeah.
Right.
So Schmovid actually, like, it seems like it would have made it worse, but it actually made it a lot better.
No, it's, in times of crisis like that, that's when people have the opportunity to reflect and rise ultimately, which sounds like you took full advantage of.
Never let a good crisis go to waste.
Never let it. That's somebody said that.
I think it. Okay.
It's a financial expression.
Yeah,
that's
I can't remember who said it either.
But if you know where that's from, please leave it in the comments because we've heard that. Never let a good crisis go to waste.
We could Google it, but we're gonna let you do that.
Yeah, we're gonna let you Google it for us. Thank you. Appreciate that. All right. So next up, we'll clean you up and get you in the chair. Okay.
Got it.
Kiyan, How did you find all of that?
It was good. It was fine. I was obviously a little concerned, right? Because I haven't had my neck adjusted at all. But yeah, it was good.
Perfect. I'm happy to hear that you had a positive experience. I know that when Kiyan first came in, I was kind of telling him about the things that I usually do on these videos, and like with what he was telling me about his neck issue, how this would definitely be an adjusting situation. And I think your first response is, "Can we not do that?" that was the first thing that he said. I was like, okay, so I'm gonna have to do a little bit of reassurance.
You need those ASMR cracks,
first off, you guys are clicking these videos because you like the cracks. And second off, with his patient case, it is actually warranted to try this modality that hasn't been tried before if you have chronic, long-standing neck pain and if it's never been explored. That being said, never do anything you're not comfortable with unless you start to learn more about it and you start to become comfortable with it. So on that note, thanks for being optimistic and open-minded, right? Overall, I'm confident that we're able to get something like this under control if we were able to check in every now and again, okay? And we can talk more about a potential treatment plan off camera if you like. At this point, do you have any questions for me at all about anything that we did or about how you could manage this or anything, or are we good? We good until next time?
So when it comes to people with like a particular case like mine, like how often do you see something like this? Is it like kind of common?
Like how frequently do I see people who've had like neck pain for a long time?
Yeah.
So neck pain and back pain are probably the two most common reasons that people will see a chiropractor, and maybe the third being like a headache, which can kind of tie back into the neck pain as well. So I'd say like with your specific case of having had it for like 10 years, none intended, that's not particularly common because, more people will seek assistance in the time range between that. They won't wait that long. But like as far as neck pain patients go, oh God, I see like five new patients of it a week. Like it's an incredibly normal and common complaint. That's why I'm not concerned about it. We did a neuro exam. You got nothing neurologically going on in the upper limbs there, so I wasn't worried about treating that either, right? So any other questions?
This is something that my clients would ask mostly, right? So when it comes to like an osteo, a physio, a chiro. There's so many things, and there's even in the training sector. There's like this type of trainer, that type of trainer. Right? It's like, so how do you navigate through the confusion of where someone should go?
So I love this question because it's in my opinion it's a question that has come around because there's just so many different ways to complete one job. Okay, there's so many different ways to hammer a nail, so to speak. I'm not calling you a nail, I mean a hammer. But at the end of the day, like I mean physios, osteos, chiropractors, massage therapists, acupuncturists, they all work on mechanical complaints. Okay, and they all kind of have their own methods to go about that. All right. Different conditions respond better or worse to different interventions. Okay, some conditions respond way better to acupuncture than being adjusted. Some are way better and mandatory with physical rehab as versus just massage, right? It's a little bit of everything in there. But when it comes to seeing a practitioner and choosing which one you should go see, the honest answer is any of them will potentially work for you. Okay, so what I advise in people's cases if they don't know who to go see because they don't know what their diagnosis is, which is most people because they haven't gone to school for X amount of years to learn about this kind of stuff, is see somebody who kind of does all of it, or what I refer to as a diversified practitioner. I myself am a diversified practitioner because it's what I found to be the most effective for people, right? So in your case of this long-standing neck discomfort, I know you tried the acupuncture before. It didn't really work very well. It made things worse. You're a very physically fit guy, okay? I look at you. I know that you've been exercising, so I'm not too worried about the physical rehab perspective. I know you tried massage. You haven't really done too much of it though, and I know you haven't had your neck adjusted. So what am I doing? I am supplying those other hammers to the nail, right? The massage therapy and the adjusting. Whereas the acupuncture, we know that makes it worse, so we might lean away from that, right? It might not necessarily make it worse again, but we've had a poor encounter with it, and you're going to keep exercising. I know you're going to do that, so I'm not even worried about it. I'm not going to talk about it, right? So to that end, find somebody who's going to be able to figure out your diagnosis and then offer any of the different treatment styles available to you. You can look for the word diversified there, but at the end of the day, it matters more about the practitioner themselves rather than their title. A physiotherapist can be diversified, a chiropractor can be diversified, a massage therapist can be diversified. The person, look for good reviews and referrals from friends. That's the thing that matters the most. Or YouTube videos where they showcase exactly what they do. That's why I do this.
Because that actually leads into my next question. What to avoid completely
Yeah,
because that's a big one.
In terms of what?
So then this could be a bullet question. We can take
Go,
this one.
no, that's okay. I love controversial questions when somebody else brings them up.
If it's not yourself, right?
Exactly.
Because like there's things where like I would never recommend for people to go see this particular person when it comes to weight loss. So I think there's way more effective means of doing that.
Yeah,
right?
exactly.
But for you, it's like if someone has like an acute injury of some kind, what would they not want to go do?
So
right? And they're about to go see someone. So what are some like red
flags in terms of like practitioners that they're going to go see then?
Yes.
Yeah. Okay. So I actually have a whole YouTube video about. I'm going to use the word predatory chiropractors. I created a YouTube video about this to warn people in situations like that. Why? Because if you are in acute pain, that puts you in a very vulnerable state. Okay, and if you're going to go see any kind of practitioner, whether they're a physiotherapist or a doctor, you're probably going to take them at their word because you're in pain and you want to get out of pain. So if they're saying, hey, I can get you out of pain, you're probably just going to agree with whatever the hell they say. Okay, so I made a YouTube video. You can watch it up in the corner, the top right corner there. Basically, first thing I'm going to recommend for anybody in that level of pain is to just try to slow down for a second, okay? Because there are some chiropractors who will charge very large block fees. We're talking like multiple thousands of dollars to sign up for 40, 50, 60 sessions all on the first day, okay? That in itself is a huge red flag, all right? Here I only do on the per visit basis. You come in, I treat you, you pay, and then I see you again whenever I see you again, right? But if your practitioner, chiropractor, or physiotherapist only offers those big block bulk billings, I consider that a bit of a red flag because you're in a vulnerable state. You're not thinking clearly. Would you drop thousands of dollars any other day? Probably not. Okay, that's the first thing. I'm not saying there's anything wrong with it, but I'm saying that that's something to be aware of. The second thing is any practitioner who uses the exact same treatment approach for every individual. Okay, and if that's or if you feel like they don't give you the time of day, if their appointment's only about 2 minutes long, how can a person possibly take in all the new information, process it, and then apply that to the current treatment if they're spending less than 120 seconds with you? Okay, so make sure it's somebody who sits down and asks how you're doing, takes time to process it, and then adapts as needed. And ask 2 questions. I kind of got distracted there, but number 1, avoid the big block expensive things. Number 2, make sure they're spending some quality time with you. And number 3, make sure the treatment plans are varied from person to person because every condition and every person is different. Not everybody needs the exact same thing. Did I go on a tangent there or did I answer your question? I think I answered your question. Okay, good.
And you went on a tangent.
I do that a lot.
It was a little tangent. It was a little side road.
It was related.
It was right, but it was good.
Any other questions there?
I think that's everything because we could have another hour's worth of content.
I feel like you and me could probably talk for a while about this kind of stuff. So that'd be fun. So again, Kiyan, this is nothing concerning. I'm sure that we can help you out in those bad flare-ups should they come up. Thanks for coming in. I'll see you again soon, I'm sure.
It was a pleasure.
You take care.
Thank you so much. Don't forget to like, comment, share, and subscribe.
Thank you so much, Kiyan.